All right, good afternoon, everyone. Again, my name is Terry Phillips, and I am the facilitator for the Heroin Task Force. Little facilitator, a little project manager, kind of a little jack of all trades. We welcome you to the quarterly community partners meeting, and I'm going to share my screen and welcome Mary Simon, who is one of our co-chairs, to take it from here.
Hello, everyone. Thank you so much for joining us today. I am here representing both Larry Nelson and myself. Larry had to be at a different meeting, and so he sends his regrets that he can't be with us today, but you get me, lucky you. So I am just gonna go through a few of these slides to start with. Again, just want to welcome everybody, say that we're really happy you're here. We think we have a good plan for today's time to make it a good use of your time. We want to give you a few updates on the Heroin Task Force and some things we've been working on behind the scenes. We want to continue to help build connections within the community. The work that we do really requires everybody to work together. And so we love these meetings where we can all get together and kind of hear about what's going on and see how we can work together. We want to give you some updates on what our action teams have been working on over the past year. They've been very, very busy, so we want to update you on what they've been working on and where they see themselves going in the future. And then we're going to do some small group stuff. So to give you some time to reflect and talk and network in some breakout rooms. And then finally, we're going to give you an opportunity that if there are items that come up during this session that Terry calls it the water cooler discussion. So just a chance for people to, after the meeting is over, if you want to do a small breakout session around a topic or something that came up and you want to do some extra networking, we can facilitate you going into a small group if you would like to do that. So if something comes up along the way and that sounds good, let us know and we can certainly set you up for our water cooler discussion.
Perfect. Thanks, Mary.
Yeah. So you can see our goals for today. I have to move my thing. You can see what our goals are for today. And yeah, next slide.
You bet.
So just a reminder of what our vision is, looking at taking a collective community approach, and the 4 action team areas are prevention, harm reduction, treatment and recovery, and data and reporting. So those are the groups that you're going to hear from a little bit later about the work that they've been doing. Today, our focus is on what things are always changing when it comes to substance use disorders and opiates and heroin. So what shifts or changes do we need to make as we work together so that we can continue our collective work to break the cycle of substance abuse? So that's the focus of today, what we want to kind of hone in our discussion this afternoon. This is the cool part. So we got a new logo, everybody. Yay! We had created this logo and this tagline. The design team behind the scenes did that, and then some representatives from the county worked their magic and redesigned it a little bit for us. You'll see the purple and the turquoise colors, which are the colors of recovery. And so we felt like it was really appropriate and a good way to incorporate our work to add the turquoise and the purple to our logo. But this is our new logo. Is it not cool? So yeah, that's it on the logo.
And I was going to say, everybody got the agenda. So should I just go on to the next one?
Yep, that sounds good.
Right. Oh, and this slide was just a reminder of our shared learning opportunities that we've had. Sorry, Mary.
That's okay. That's okay. These are the things we've talked about over the last year. So we're always, the design team is always open to feedback or on the sessions or even speakers that you might like to hear from. So reach out to Larry or I or Terry if you know of somebody who you think has some valuable information that you think should be shared with the whole community, feel free to reach out to us and let us know that.
Thanks, Mary. All right, then I'll take it from here. Um, just a couple of quick things for those of you who are new to us, and we have a few of you, so welcome, welcome. We are using Zoom, obviously, as our platform today. We frequently use the chat, so at the bottom of your screen, you've got the opportunity to use the chat function, and feel free to use the reaction button. If something strikes you and you want to, put a heart or whatever, please do that. There's also a hand raise feature at the bottom of the screen under the reaction, and we do use that in this larger group. So if you can do that to ask a question, we would appreciate it. Otherwise, if you can't find it, unmute and we'll get that question answered. Just kind of talked about some of those things right off the bat. These are kind of our guidelines that we've had for the last year or so. We ask you to kind of keep muted just to keep background noises out, but we do want to encourage conversation, and just turn off your phone if you can, and be present and aware. This is an hour and a half that we want to be able to interact with you, and give you an opportunity to connect with community partners. So we want you to be able to use every minute of it. And that is it. So we are actually going to start with a reconnecting exercise. So we are going to start with, again, our community partners. We have over 200 community partners on our email distribution list, and we're getting between 40 and 50 at each of these quarterly meetings. But when we're in a virtual setting, it's not like we can stop at the door and get to know one another, and that's why we want to leave it at the tail end too. That water cooler discussion that Mary alluded to, if you want to hang out and talk a little bit more about something in particular, and some of others of you want to, we want to give you that opportunity. So we're going to start with a breakout room for about 8 or 9 minutes. And I think, Becca, you've got us down for 9 minutes. Is that good? We're going to break you into, and how many people do we have in each breakout room, Becca?
There's one group with 5 and the rest have 4.
Perfect. Okay. So take a moment to introduce yourself, tell, a little bit about who you are, what organization you're with, what brought you to the Heroin Task Force. And the question we want you to discuss is, what issues regarding opioid use are front of mind and feeling most pressing and urgent? So introduce yourself, and then we would like you to think about your answer to that question and share amongst yourselves, and then we'll capture some of that when you come out of the breakout room. No notes need to be taken on this one. If you want to take some hand notes, that's fine, but we'll talk about it when you come out of the breakout room. Does anybody have any questions? All right, so for those of you who haven't been in breakout rooms, take your hand off your mouse, off your keyboard, and Becca will put you automatically in the breakout rooms. So I'm going to stop sharing and we will go right in. Have fun, everybody. So welcome back after our breakout room discussion. I am going to share my screen one more time here and invite you to share a little bit about what you heard in your breakout room. So take your phone and hold it up to the barcode, and you can begin typing in some of the things that you heard that are most pressing and urgent. What issues are front of mind and feeling most pressing and urgent? We just want to capture these so we can leverage all of this information. Fentanyl, overdose deaths, youth prevention, stigma, access to MAT, no more harm reduction, counterfeit pills, fentanyl and everything, treatment. I will summarize all of this, so when you get the slide deck back next week, you will have all this information. Access to mental health providers, resources, variety of types of fentanyl, systems, kids not realizing fentanyl is in the pills, sober living, fentanyl test strip availability, effect on kids, pain management, pregnancy and postpartum, access, fentanyl awareness. Everyone is at risk. We'll give you a couple more minutes, but again, I'll thank you for taking the time to do that. I will summarize all of this. I'm going to stop sharing for a minute. Anything in particular that anyone would like to share, something that stood out to you that you feel that we all should hear? And just unmute or raise hand. I know we're capturing this information. No good strategies to reduce fentanyl coming into US. All right. Well, we'll capture this information and share that with you. And I'm glad we were able to start with that because the rest of our meeting is going to be spent doing some action planning, hearing from our action teams, and then doing some action planning. So we are going to start though with I'm going to quickly turn this over to Kirk Yockler and John Kettler, and they're going to talk a little bit about the Waukesha County Exec's declaration, the fentanyl declaration. And actually they're going to tap on you and ask for some additional information. So Kirk and John, I'm going to turn it to you. You let me know if you want me to flip to the next slide.
Okay, John's on. I saw him on, I believe. Yeah.
Yep, he sure is.
Excellent. Well, I'll give kind of a quick overview, and then John, I don't know, maybe we can tag team on the elements that we'll speak to. So hopefully you're all aware, our county executive Paul Farrow had made a public declaration at a press conference that was hosted here at the Human Services Center in Waukesha of a public health crisis, a fentanyl public health crisis, and really made the commitment to devote, resources, including some opioid response, opioid settlement dollars, and resources within the Health and Human Services Department to focus on actions that we could take as a community to address the fentanyl community health crisis. And the county exec is aware of all the great work that's being done by the Heroin Task Force and some of the initiatives that were going on within Health and Human Services and elsewhere in the community. So not all of the strategies are new. In fact, many of them are really an acknowledgement of the great work that we have been doing and will continue to be doing. What Health and Human Services as a department is tasked with is really measuring our progress on these initiatives, our sort of collective impact, and then reporting out to the county exec on a regular basis over the next year or so. We're going to start by reporting on a monthly basis, and then ultimately we'll be reporting out quarterly. So we convened a team under the direction of our HHS director, Liz Aldred, to identify some metrics. And you'll hear about all the different initiatives. I'll turn it over to John in a minute to start walking us through them. But as we looked at them, we're looking for measurable outcomes, and in some cases, it's work that we're putting together the plan to launch an initiative. And so, as we go along in that process, there are milestones that we hit, key milestones, and those milestones are reportable outcomes. There are other initiatives underway that are already generating data, outcomes-related data. And in those cases, the data is the metrics. And in many of these initiatives, it's a combination of both milestones and metrics. So I think with that, I'll pass the ball to John, and he can start walking us through our master list of initiatives that we're intending to report out on.
Thank you, Kirk. That was great. And I would, maybe I'll just briefly touch on the fentanyl thing for anyone newer to our task force and just give a really high level overview. Fentanyl being a synthetic opioid that is 50 to 100 times as strong as heroin. And it's being found not just in, cutting heroin now, it's being found in cocaine, it's being found in methamphetamine. And it is a driver of our overdose deaths. It's being found in pills that are being sold as illicit. It could be sold as illicit Adderall or hydrocodone, oxycodone. And so these illicitly manufactured pills are killing people. And in some cases, they're coming from illicit pharmacies that are online pharmacies that are not actually actual pharmacies and are selling fentanyl in the pill form. So Terry, you are right on time. This is exactly where I was going. So thank you for all who can see here. Our collective impact work, all of us working together in these different sectors, helped to reduce the overdose deaths, the great work we were doing. And you can see the decrease in deaths from 2017 to 2019. And that tells me that our model works and what we're doing works. So please keep coming back. What we see in red here, though, is that fentanyl associated deaths, as fentanyl has steadily increased in this country, the deaths are going back up again. And it's a direct correlation here. So we can see what the problem is. And in fact, I would add, some have heard about the rainbow fentanyl, as they're calling it, but I think this has spiked in a way that we're turning a corner here in a bad direction, where it's not just that fentanyl is being included in the drugs that are out there being sold, but that some are actually looking for fentanyl now. And that the makers, the cartels, if you will, are actually packaging some of this in different colors so people can go and seek the blue fentanyl. So it's not just that folks, are getting it unbeknownst to them and overdosing on it, that some folks are actually seeking this out. And that is something I think for this group to watch for and to have on our mind in our response, that we have a whole new dynamic here to deal with. So that said, let me touch on the points Kirk was talking about. And I'm really grateful for the squad that has come together to work on a collective impact modeling for how to address the fentanyl issue specifically. And that is, it ties into so much of the work that we're all doing here today. And thank you all for what you're doing. So let me share, there's 14 areas specifically that we're looking at right now. And this is a collective impact. The first is in launching more media campaigns around this. We're working towards having additional billboards, bus ads, social media, getting the word out in that way. Second, something that we've touched on in this group and is being supported by our treatment and recovery group here is working towards medication-assisted therapy in the jail. They do that currently for pregnant women, and we are working with them towards being able to increase that to allow for people who arrive on medication-assisted therapy to continue medication-assisted therapy. And a second phase goal would be to actually do inductions in the jail. So that there's a goal, and thanks to our treatment and support team here, treatment and recovery team, who've been helping to facilitate those conversations and add the gas, to keep that moving. Third is the overdose fatality review. Had just sort of initially kicked off when COVID came through and required some folks to reallocate the resources there. So I'm happy to say that is an effort that is renewing and is beginning again. And hopes are that later in this quarter, that some reviews or later in the fourth quarter or first quarter of next year, some reviews may actually start happening again, as the group is realigning right now and setting out the format for that. Number 4, testing strips, fentanyl testing strips in the community. So getting those out, that is something that is available now. And these are items that specifically test for fentanyl. So users can test drugs to check for fentanyl before they're taking them. Any drug, this could be something illicit, which is one of the first things that comes to mind. But again, any of us could be online looking for, a cheaper prescription from a pharmacy and think it's okay, but, any of us might consider testing something if we're not certain of the pharmacy we're getting from. So there really is a broad base for that. Number 5, naloxone training and distribution, something that has been happening in the county, we're happy to say, and we want to continue to champion that, continue to push that, look for new opportunities through our partner agencies here. We're getting translators to increase the number of Spanish-speaking trainings that are going to be offered, and on virtual options as well. Number 6, the deferred prosecution program that is through our DA's office, to continue to support that, and the pretrial screening, to use the best resources for those folks, to make sure that we're aligning supervision where it will help best, and use some science around that process, and to continue that deferred prosecution program for our opiate offenders. Number 7, the CHIP process, the Community Health Improvement Plan and Process, is underway. We have a number of representatives here who are involved with that work, and that the surveying has happened as part of that process led through our public health area, and thanks for that work. And my understanding is that the groups are forming goals now and prioritizing actions, and that it appears that substance use will be another top priority for that group. So anxious to see the work that will be coming out of that. And I think there will be an opportunity for alignment with our task force there, as well as there was with the previous process. So number 8, Department of Health and Human Services, addressing through treatment and through our community treatment providers. So looking for opportunities to leverage, to increase MAT options for folks, to ensure best practices. I know that the treatment and recovery group is working towards helping foster best practices among clinicians in the area working on this. Number 9, we want to increase partnerships. Partnerships with the community. Everyone here are great examples. We want to have foster abilities for everyone to work together on this, and see how we can increase that. Number 10 is this heroin task force. Thank you all. The amazing opportunities that you're creating here, and all the work that's being done in the community. So being able to to support that, and as we move forward, looking, are there needs that we have? Are there opportunities for collaboration that we have? How can we as a group continue to do that? And our 4 action teams are doing great work, and then I have no doubt that this is helping move the needle. Okay. Number 11 is looking for opportunities towards state policy. What would we advocate for? How can we advocate for? What would we like to see? Thinking downstream a little bit. 12, leveraging data. Thank you to the data team here for all that they are bringing and making available, and looking at ways that we can continue to get metrics around this issue, and to help support the work of the other groups. Number 13 is direct outreach, and there are direct outreach activities. I know HHS does direct outreach with some consumers that have been identified who have overdosed, and their families as well. So looking to increase that that outreach, and have other groups doing that as well, and where can we partner and possibly bring in more peer support for those activities, and connect them to resources. The final one, number 14, is prevention. And there are prevention activities that have been happening. There are now 4 licensed prevention agencies in the county. All 4 are doing work, and thank you for that. And our prevention team here is putting together great things. And so we want to work with the prevention activity, and see how we can foster that and bring resources to that. So I have an ask from everybody today, and this is a please type in the chat box ask. We have a lot of different metrics around these things. We can measure how many media impressions happen, how many days of billboards are out there. There's a lot of different pieces we can kind of get to look at, what is being done. So we can maybe, look in and see what we have done. But how do we measure the collective impact of all these activities? How do we know if we have, moved the needle, per se, on this issue? And I'm wondering if any thoughts, are good thoughts, please drop them in the chat box. Some ideas have been to look at the overdose deaths and fentanyl-related deaths, and that is certainly one. And I'm interested, in some others that we may have more impact on, in different ways to look at this, and how are we as a group, how is our task force, how are we as a community addressing the fentanyl issue? So looking at ambulance run data, looking at hospital admissions, those kinds of things. But any other thoughts? If anybody has other thoughts, please drop them in the chat box. I would love to copy and paste and any ideas we can come up with as a group. I think it behooves us to help us to look back and say, how did this group help move that needle? So if we can share in the chat box any ideas we have for that. And while folks are doing that, I'm going to bounce the ball back to Kirk. Kirk, anything I missed or anything that you would add?
No, thank you, John, for going through that. And I'll just share with the group, this is kind of a high level overview of the different initiatives that we plan to report out on. We'll share the kind of master list with Terry, who can get that out to the team of the initiatives themselves. The metrics, the milestones are still a work in progress. And again, that's why we're reaching out to you for some ideas. I think that part of our follow-up, though, will be for those action teams or individuals that are been involved in a particular initiative that John just covered. It is our intention to sort of vet our ideas around metrics and milestones with those groups, and sort of get them endorsed or get some edits or additions to those. So it may be easier to respond once you've got the list in front of you, some ideas that you have for things that we could measure and report out on. So that'll be just part of the follow-up.
So some of them are coming in, Kirk and John. Treatment admission rates, how about success stories where efforts have saved lives, Narcan distributed, naloxone dispensed, increased number of people accessing services, increased percentage of individuals successful completing treatment, and decrease in overdose deaths, listening sessions with people in recovery treatment. Vivint would have the most accurate data for IV use in the county or needles distributed. So you've got a few ideas coming in. And we'll send that list out that Kirk was talking about that John just reviewed, and perhaps we'll gather some additional ideas. And I'll summarize these for you guys. Any comments, questions for John and Kirk? This was really hot off the presses. They've been working really hard on this.
I'll just do a little kudos to HHS because it's a very comprehensive approach, which is nice to see. It's focused on, all the different strategies, and that's nice to see. Sometimes we just get lasered in on one strategy, but so kudos to you guys for thinking broad.
Thanks, Mary. Any other comments, questions? All right. Then John and Kirk, thank you so much, and we will move on. You guys okay with that?
Excellent, thank you.
All
Thank
right.
you for everyone for all the amazing ideas in the chat box. Excellent.
These are great.
suggestions.
And John and Kirk, I'll pull these off the chat and get those to you.
Thank you.
All right, great. So from here, we are going to take a few minutes to have each of our action teams that have been working, as John mentioned, very, very hard. They'll give you just a high-level summary. We sent out some information earlier with the agenda, but they're going to introduce themselves, these co-chairs, some of the things that they've been working on, some of the things that are left in 2022, and then from there, we will go into some small breakout rooms to digest a little bit about other things that we might be doing for next year. So I'm going to share my screen, and action team chairs, if you can take maybe 3 or 4 minutes to highlight your slide, that would be wonderful. Whoops, and are you guys seeing my screen or? Yep, okay, great. Let me go back here. All right. All right, and first of all, let me just recognize too our action team chairs. They have really, they've been quite the leaders this year. So thank you to all of them, because leading groups it's a lot of work. So it's a lot of work, but a lot of good payoff too. A lot of good things happening. So prevention, Mary and Jake, we'll start with you guys.
Jake, I've been doing all the talking. You can go
Is he still on with us? There he is.
on. Okay.
Perfect. Okay, can everybody hear me? Sounds good. Okay, so for 2022, our big accomplishment was we did a webinar that was more directed towards seniors, where we normally think of prevention in the youth. We wanted to do something on seniors. We had 27 attendees live during it, and there's been 43 views on the YouTube channel. It was a wonderful presentation. We had 3 different speakers. It was a pharmacist, a therapist, and I forget the third. Mary, if you want to chime in for that.
I think we had a psychologist,
Okay.
Andy. Oh,
Yep. Want to make sure we give them all credit. They were wonderful. We've done the flyers.
We had a physical therapist.
And the physical
Yes.
therapist, yes. So we've done the flyers for the drug take back, and just for everybody, we have the next drug take back is coming October 29th, just to think ahead. That's the National Take Back Day. It's a Saturday. And we have what we're currently working on right now is we're researching different materials on how to have different difficult conversations with your loved ones, and that goes for your kids as well as your spouses or even parents. Challenges in 2022. Everyone was busy. We had a lot of people jumping in and out, including me. How to show that we are making a difference, data and outcomes. You know, we really had this idea that prevention is really one of those difficult ones to track. We can talk, who we've given these messages to, but we really don't understand for years if we're making a difference or not. There's lots of different directions that we can go. That was another big one right now. Do we want to focus on youth, on overdose, substance use disorder, fentanyl? What really is our lane? You know, you could talk about prevention as pre-diagnosis, or you could even talk about prevention as preventing overdoses or things like that. So we wanted to make sure we stayed in our lane, and that created a little confusion for us as well. Going forward to action for the rest of 2022, we kind of wanted to figure out, what we're going to do for 2023, be a little bit more prepared, figure out what lane we want to stay in. And then we are also updating the drug-free communities heroin toolkit, which include fentanyl. That was a fantastic thing that the drug-free communities built that has a ton of information on all different opiates, different resources, how to identify. So we're going to make that a little bit more current with some of the more current statistics and facts, and hopefully have something else for them.
Jake, thank you so much. Questions for the prevention team? All right, Jake, nice job. Moving on to harm reduction.
I'll start, Randy, and then if you want to fill in the blanks. We started to promote the Never Use Alone campaign, which is a 24-hour hotline. Someone can call when they're going to be using their drugs, and if they go unresponsive, they would send first responders. This was started by a gentleman who had many overdoses, and we're actually going to try to get him to come and speak with us at some point. We had a lot of success doing listening sessions with people with lived experience. We did this on a number of occasions using our drug court graduates who volunteered to help. They were absolutely wonderful in giving us a lot of information that people that aren't in this area wouldn't understand. Just a plug for the treatment courts. Since we've started peer support programs in our treatment court, knock on wood, I have not had one person reoffend. Now, that doesn't mean they don't relapse, but they come to us. And using the peer supports, people who have been there, they understand it better. So anyway, that's a plug. The wax boxes, we're getting our I'm having a hard time talking. They're going to be placed here in WCS shortly, and Alano Club through the Addiction Resource Council has a naloxone vending machine. Randy, I'll let you talk about probation. Waukesha Freeman is willing to do PSAs. One of our gals has been in contact with Waukesha Freeman. We feel that advocating for peer support services in every program is extremely important. DOC is now funding a peer specialist here in Waukesha. She works for me in our office here for anybody that's on probation. So when the times get tough, there'll be somebody there to talk to them. Randy, I'm stealing your thunder, but man, for probation and parole to take that step, and peer specialist services are positive reinforcement. For probation and parole to be on board with all the things that they're doing, I'm extremely impressed. Overdose Awareness Day was a good success. That was at Frame Park every year. It's held on the 31st of August. Did you want me to show a picture?
Yeah, I do. Let me stop
Okay.
sharing here and you go right ahead. I asked Susie just to share a couple of pictures from the event. They had over 100 people, Susie.
Right, probably right. John, we talked about it, probably between 80 and 100. All of the seats in this shelter were full. And the people, everybody lit luminaries for people that we've lost to overdose. So the entire shelter was lit. So as you can see, we started in the light and we went as long as people wanted to go. And the stories were 2 hours. And it wasn't anything long and drawn out. People got up and talked for the first time about losing their son, about losing their daughter, about all the, and this is a safe space that they can come to not feel the stigma and be able to talk about overdose. So this is I think it's a wonderful event and I think it went quite well.
Thanks, Susie.
Yeah, you can put the other one back on.
You bet.
While she's doing that, we're also having a community event this week, Saturday. I think we'll send that information out before the end of the day. It's we're having a softball tournament. There's volleyball going all day long. There's a lot of activities, free food, resource tables. Everyone in our community is invited to go. It's at Banting Park. So challenges. People are afraid to use the 24-hour hotline. The sad part is I had a conversation with a gentleman in our drug court, and I told him, please use this card, call. And he said, yeah, I'll do it. But when he passed away the following week, this is one of the cards I gave him. Our judge has been handing these out to people. So that's what one of the challenges is. How do we get people to trust the process, to trust the line? Community partners are not excited about the idea of naloxone boxes in public places. I had to go through a lot of red tape to get them here in WCS. So incredible amount of stigma still exists around substance use disorder. And I don't think I need to go any further for that. We need funding for peer support programs. We're hoping we can get those. That's probably one of our big ones was getting it in the jail. So I was at a meeting at the jail one time and they said that 3 people in the last week had left the jail at 4 in the morning when they let them out and they died that same day. So what can we do? We've we started a little project that's long-term, so I'm not really supposed to talk about it, but I'll talk about it real quick. We'd like to have first responders on a team for meeting people where they're at. Waukesha Overdose Response Team hopes. And we're going to actually start it before the end of the year in a real small way. We have someone donating space for it. So we're going to use our drug court graduate peer mentors because they're very willing to do this. So it's pretty exciting. I'll let you guys know more as we go. Community support is a challenge, especially with things like recovery housing. Our people in our courts have to live in Waukesha County, but it's difficult when nobody will rent to them or there's not affordable housing. So Action for the rest of 2022. We're going to revisit the syringe exchange program. I've had some conversations recently, and I think it's important that we revisit this because it's important as well. What we want to carry on to 2023, old and new, something we're going to be looking at the rest of the year. Packets with information cards. That was one of the items that came out from our discussion groups with our recovering persons, and actually putting fentanyl test strips in them. Revisiting worth. Start small with the peer volunteers. That's what I was talking about earlier, and picking them up when they're released for jail. Continue to promote the Never Use Alone campaign, evaluate the team who we're missing, and we just put a couple more new people on our team, so we're excited. Promote recovery at the recovery event on September 17th, and advocate for peer services in the jail. Randy, did I miss anything?
Nope, you did an outstanding job.
Such a good guy.
Thanks, Susie and Randy. A lot going on there in the harm reduction action team. Questions or of clarification or about any of these programs that Susie was sharing? Okay. Thank you guys so much. Treatment and recovery. I don't know who is on for treatment and recovery. I'm not sure. I was watching to see who came through. Do we have any of our Chris Olson? I don't know if he's on, or Sarah or Colleen. We might not have anybody on. John or Kirk, are you guys involved with this one at all?
I've been able to attend a few of their groups. Was not able to attend the one yesterday. So if anyone on here was, feel free to, pop in.
John,
I can.
Yeah, I'm just thinking we can probably at least provide some updates on where we are with the MAT in the jail.
That would be great, Kirk. Thank you.
Yeah, so we've HHS has taken the lead from this action team, and it really brought I would say the political capital of the Heroin Task Force to bear in approaching our jail leadership. And the WellPath team, which is the contracted healthcare services within the jail, and launching the initiative around can we make a plan? Can we get agreement that we should be expanding the MAT services in the jail beyond those just for pregnant women? We've formed a work group that includes Rebecca Luchai from our CJCC services, John and myself, those are the HHS representatives, and Angie Wollenhop, the jail administrator, and Tracy Lewandowski, the deputy administrator for the jail. And they have the support of the Sheriff's Department behind them, and then several members of the WellPath team. Our last work group meeting, we actually had their medical director for WellPath, which is a national company. They basically focus on medical services in jail settings, but this is the medical director for their medication-assisted treatment services within jails. So really going to have access to a seasoned consultant on how to launch these programs, what resources are needed. Our intention is to gear up for the balance of this year for launching, hopefully in early 2023, that phase one of that program, which would be offering MAT to individuals that come into the jail already being prescribed MAT in the community. And then from there, our intention is to expand the program to be able to induct individuals coming into the jail on opiates who are interested in coming off of them and getting on MAT, or individuals that are coming in withdrawal and looking for an MAT treatment. So we're very excited about that. It's exactly what we hoped we could accomplish, and I'm just really pleasantly surprised that we really aren't running into any significant hurdles or resistance as we continue to move forward with this initiative. John, anything you'd add?
I think that was a great summation of the MAT in the jail. The other, I might just put in the other two items being worked on in treatment and recovery are a survey to the MAT providers. And they have tweaked a survey that was used sort of in the past around best practices, and are now, from my understanding, preparing to share that with the local providers to try to, foster best practices for MAT treatment. And also are looking at the transportation challenges that are kind of perennial in the county, and are looking at opportunities for that. And I know that we have representation. I know Sarah Keene from Maida House has joined us today. They had some ideas too on transportation issues, so they're going to be joining up with treatment recovery group and sharing their thoughts. And we look forward to the opportunities that may come out of all that.
Great, fantastic. Thank you so much. A lot going on there. Big steps. And then finally, our data and reporting team. Felicia, I know you are here. So I'm going to turn it to you.
And I'm going to turn it to Adele.
And Adele is here. Okay.
Hi. So I'm going to make this quick because I know we still have another set of small groups to get into. But for the data and reporting team, we made a formal recommendation to relaunch the overdose fatality review team, the OFR, which is very exciting. And it seems to be that the department and all of those powers to be are really behind it and support it. So we're all excited to hear about that. The website to host the data, Elevate, the organization I work for, and the greatest boss ever, Mary Simon, has designed and is working on the website. So I can't take full credit for that or accomplishment for that, but we are looking at designing our own kind of data dashboard, or a part of that page is to create some data on it. Collaborated with the tri-chairs of the other action teams and the members of the steering committee to identify data that they need to do their work, and provided them with data. And then we had a data search comparing Waukesha County data to the 4 counties throughout the country, one each in Colorado, Kansas, Minnesota, and Washington. Challenges faced in 2022 was there's so much data out there. It was tough to kind of decide where to go first, what to do first, how to decrease it, how to organize it. Limited time and resources for everyone, as everybody kind of does this on top of their regular job. And then having unclear tasks or kind of a clear direction when it comes to the website. And we were able to work all of that out. And so we're just really looking forward to putting content together for that. And I will pause now and give it to Felicia.
And then for the rest of 2022, we're really working on deciding our top links or data points that we want to put on that website. And we still have this dream of a big, beautiful data warehouse that has lots of links and resources. And of course, assisting any of the other action teams with any data or needing them or helping them count or whatever their data outcomes as well.
Felicia and Adele, thank you. For those of you who are new to us, the data and reporting team emerged as part of a summit that happened in June 2021, I think was the summit. And it was clear from that summit that there was a desire for us to be sharing data, trying to identify metrics to measure, things like that. All those things bubbled up at that summit. So that was the inception of that team. So thank you guys for working hard and trying to figure out exactly what our teams need to support their work. So thank you guys. Any questions for these guys? All right, wonderful. So you have now heard, I'm going to stop sharing for a second so I can see all your lovely faces. So you've now heard from our action teams about what has happened in 2022 and what they're anticipating for the next, couple of months before as we end the year. Our job today is to take the next step forward and to start thinking about where we can go in 2023. So we are going to break into small groups, and the questions that we are going to be, or the main focus question, and Mary teed it up for us, What shifts or changes are required as we work together to build momentum in our collective work to break the cycle of substance use? So I'm going to actually just shift to the questions. There's 4 questions we're going to be asking. What threats are on the horizon that we need to be aware of? So we talked a little bit at the beginning of the meeting, fentanyl's out there. There are other things that you all are aware of in the work you do. We want to document these, and we're going to pull all of this together from the breakout rooms, but we're gathering data from the experts. Where do you see the greatest need or opportunity? What are 2 to 3 actions we might consider taking in 2023? And that could be across all the action teams. What are some of the pressing things that we should be looking at for 23? And then we'll be collating all this data. And then finally, this is a little self-serving on my part. We want to make sure that these quarterly meetings are useful for you. So what other topics of interest should we be including in these quarterly meetings? So those are the 4 questions that we're going to be asking you. And we're going to be putting you in breakout rooms for 15 minutes. We were going to be in 20 minutes, but now it's going to be 15 just because we're a little bit short on time. So your scribe, first of all, thank your scribe because they've been doing this for me for about a year. So please thank them. They'll share the screen and lightly facilitate and make sure that all the voices are heard. Your team will answer all 4 questions and select a reporter to share 1 or 2 items that stood out to you. We don't want you reading the screen, but just 1 or 2 items from your slide that you want to share with the full team. Any questions? All right, Becca, put us in the breakout rooms, please.
A lot of our conversation kind of centered around education, the needs for different education, increase awareness in the community. And our number 1 threat, the shark in our waters, is fentanyl. And we want to, continue efforts around that, education, awareness around that, and anything we can do to touch on that.
Great, thank you. And I see that you said some public awareness here, PSAs, billboards. Our group was really focusing on communication as well, and you'll hear from them. Here, thank you to my group of Sarah, Jess, and John, and Lisa. And Lisa's going to speak for our group.
Yeah, and just like you said, Terry, we had a lot of talk about, again, similar things that other people talked about: education, stigma, the need to get information out there, the fear about fentanyl, all of that. And so we really talked about like an intentional, targeted, coordinated media campaign with our partners, right? How could we take a look at really utilizing our partnerships throughout our community to blast out all of that information? And each month could be something different, and we could be sharing it, and we could be, really that targeted effort. And in that, we talked also about, we talked about key leaders in our community. Do we have the ear of the key leaders, and are we providing them key messages of this group that they can take out when they're talking, right? I mean, Terry, you said, I wish they would be out there talking more about us. Well, how can they if we're not feeding them the information?
Yep, absolutely. Thanks, Lisa. All right, and Nicole's group, they also followed instructions.
We talked a lot about grant funding and how the opportunities are there right now. It's available, but we need to work together as a team to do some structural planning and create some actionable goals to get us to those big partnerships where we can take advantage of those funding opportunities that are out there.
Great, Nicole, thank you. Thanks so much. And Mary.
Yeah, we had some good conversation too. I just went back and highlighted some things that I thought were critical. The behavioral health workers, having enough behavioral health workers to meet the demand is always an issue, but also about advocacy, and can we use the collective impact that we're building with the Heroin Task Force to do more advocacy around some of these tougher issues.
And are we clear on what we're advocating for? Because I'm not sure we have that ironed out as well, but yeah.
You only gave us 20 minutes, Terry.
I know, I only gave you 15, right?
15, exactly.
That's it. All right. So, okay, let me just do this. I know we're getting close to our end here, but just real quickly, what common themes are you seeing, or what did you hear that I didn't give you a chance to really read through everything, but anything standing out to you? And you can just unmute.
Stigma was common theme.
Yep, got it. Thanks, Christine. Who else? I heard another voice.
I think another common theme is just everybody working together collectively somehow.
Making Thank you.
Communication.
Communication. Oops. Yep.
Psychoeducation,
One more time.
psychoeducation.
Does everyone know what that is? Or can you give us a 2-second, a 2-minute, 1-minute overview?
Just education about addiction and, you know, maybe some prevention help or support for the families.
Perfect. Thank you. Thanks, Sonia. Others, anything else?
I think resources are always a hot topic for everyone.
Mm-hmm. How are we going to make this happen? Okay. I'm going to skip our second question here and go right to this question. So grab your phone and please share with us, what are you looking forward to as we continue our journey together? Collaboration, less overdose deaths, sharing ideas, stronger partnerships leading to change, learning about resources available to our communities, making a difference, networking, accomplishing things, community impact, seeing the impact of the initiatives we launched in the community, learning, targeted messaging. Excellent. Again, all of this will come back to you sometime next week when we summarize everything. Saving lives and getting people into recovery. Saving lives. A shared workload. Awesome. You can continue adding and breaking down barriers, and I will add those in. Thank you all so much. And this is just, I threw this slide in just in case anybody had anything they wanted to share. Is there any, like Susie shared the news about the picnic this Saturday at Banting Park. Anything else people need to share or want to share? Something hot off the presses. And if you think of something, throw it in the chat. All right, Mary, I'm going to let you take us home.
All right, and so just as a reminder, Terry and her team will be putting together a slide deck and all the notes that we've taken and the recording. So please feel free to share that information with others that weren't able to be here. You know, our work needs to be talked about, needs to be shared. People need to know what we're doing and the importance of it. And the more that know, the better off we all are. So feel free to share that information with others and review it. And we're always recruiting for new action team members. So if anything really stood out to you or jumped out at you of what the action teams are working on and you want to be a part of it, feel free to reach out to Tristan or myself. I'm happy to connect you with the co-chairs. We always like new people and new ideas coming to the table. So if there's something there, feel free to reach out. We're the steering committee behind this group. It will be meeting and talking about what we've learned and talking about what we hear, and that it's going to be an important piece to our planning for the future. So thank you for taking the time to join us today. another meeting on December 13th that we're really excited about. We really hope that you all join us. This is about taking care of yourselves. These are really hard times that we're in right now. Everybody's working really, really hard, and sometimes we forget about taking care of ourselves. So we have arranged for Philip Chard to come in and do a short presentation about coping during the holiday season and how do you take care of yourself. So please join us for that, because we need all to be on our A game to make this work happen, and that means taking care of yourself. So excited about that presentation, and thrilled that he agreed to come in and talk with us. So please join us.
Mary, thank you. And I think we're going to try to extend that to others as well. So we'll get more information out to you in a little bit. So folks, that is the official end to our meeting. As your facilitator, I want to thank you all for spending the hour and a half with us today. This was really jam-packed with a lot of really good information, and thank you, as Mary said, for sharing your information. If anybody wants to hang out, have a soda or a cup of coffee with me while talk about whatever, please do. I'll stay on. We are so grateful to you as partners. So thank you and have a super day.